We were recently presenting to a group of CPA accountants and we shared an update on New South Wales workers' compensation, which was specifically focusing on the impact of COVID as well as mental health trends. And there was a lot of great insights, and we thought that our broader audience would very much benefit from sharing the information. So firstly, CSIRA, the State Insurance Regulatory Authority, released some very interesting statistics regarding the number of COVID-related New South Wales workers' compensation claims that you can see on your screen now. As you can see, there's been a massive increase in the number of work-related COVID claims from around the 15th of June 2021, with the most recent numbers showing a total of 23,679 claims. There's a couple of other interesting insights that we can take out of these numbers. So firstly, at the beginning of the pandemic, the New South Wales workers' compensation legislation was updated to include a presumption of contracting COVID-19 at work for specific industries, unless of course it could be demonstrated otherwise. Now these industries included health, retail and hospitality, and a range of other high-risk industries. The legislation is still in force today, although we do note that its removal is currently being debated in Parliament. The reality is that the combination of this legislation and the removal of contract tracing at the height of the pandemic led to a scenario where it was really difficult to demonstrate where the virus was contracted, and therefore this may have been a major contributing factor to these higher numbers. The second interesting point is that just under 2% of the claims recorded were as a result of adverse reactions to the vaccine. Now from these numbers, there are two possible insights from our point of view. Firstly, there were some challenges experienced in the federal government scheme providing compensation for adverse reactions. Now we need to remember that this scheme has requirements of a certain amount of time spent in hospital, as well as a few other eligibility criteria. It's possible that some of the claims reported here in the New South Wales workers' compensation statistics represent those that fell through the cracks of the federal scheme. And the second insight is that these claims might also be representative of employees of businesses who went above and beyond the government mandates to implement mandatory vaccination policies for their business. Albeit this simplistic data really doesn't comprehensively show this, in our view, it's not too far-fetched. The final insight is that, again, just under 2% of the claims shown in this data set included a psychological component. This in particular drew our attention as the most recent data we could find indicated that the average mental health related workers' compensation claim across Australia was 26.6 weeks. To put this in perspective, this means that the average mental health related workers' compensation claim is more than 6 months, or more than the average spinal cord or nerve damage related claim. Certainly something for employers to stand up and take notice of and formulate some strategies around, such as implementing an employee assistance program for which we recommend and provide access for all of our members here at On Demand HR.
Does your business currently have a HR or workplace relations issue? Are you unsure how to work through compliance issues and still achieve a good business outcome? Why not take advantage of On Demand HR's free 30-minute online consultation with an experienced HR consultant? At the end of the consultation, we'll also provide you with a strategic action plan to resolve your current issues. To see the types of matters we can help with and to schedule your consultation, please visit ondemandhr.com.au/advice. We look forward to delivering certainty, confidence, and clarity for your business in your HR and workplace relations affairs.